Hey, good morning. Dr. Mimir here with Virginia Preventive Medicine and Wellness. I'm here with another video today on a topic that I don't think gets much attention. We see a lot of videos out there on the symptoms of low testosterone. We see a lot of advertisements on the symptoms of low testosterone. We see videos on the benefits of testosterone replacement. But what I don't see a lot of is videos on the question of, is having low testosterone potentially harmful to your health? Does having low testosterone predispose you to a greater risk of disease burden, a greater risk of morbidity and mortality? We tend to focus so much on the hype that giving testosterone might cause harm. It doesn't, in my opinion, but I think we forget to consider the consequences of what can happen when we ignore or don't even check for low testosterone in men. And I've had a lot of guys come to me, guys in their 50s, 60s, 70s, with all the symptoms and signs, and yet their primary care doc refuses to even check their levels. Many of them will say, well, low testosterone is sometimes lifestyle driven, and that needs to be corrected first. And that's sometimes true, but so are a lot of other medical conditions, and we readily treat those with medication, often for the rest of the patient's life, without any hesitation. So there's something that's really important to understand about all of this, though, or at least have an appreciation for. Once your testosterone is low, and the reason really doesn't matter here so much, but once it's low, you kind of get caught up in this vortex, sucked up into this cycle. Low testosterone, low energy, sedentary behavior, weight gain, no motivation, feelings of depression, which lead to bad food choices usually, which leads to more weight gain, driving testosterone even lower, causing even more fatigue, more sedentary behavior, more sexual dysfunction, depression, cardiovascular disease, more metabolic syndrome, diabetes. Testosterone continues to decline, and round we go. Hypertension, dyslipidemia. So we put them on a statin, which drives their testosterone even lower. So what does science say about all this? What does research show? And what do studies say about low testosterone and how it relates to disease and death? In an ideal world, we would have multiple large-scale, long-term, highly powered, randomized controlled trials where we could intentionally lower testosterone in a group of men and then compare that to the outcomes of men who maintain normal testosterone levels, everything else being equal, and see what happens over a period of decades, several decades. But for plenty of reasons, we can't do that. So the best we might ever get is something like a prospective observational study where we don't intervene, we just observe over time what happens between men with low testosterone and then compare those outcomes to those with normal levels or who get testosterone replacement to maintain normal levels. There is a difference there, even if it sounds like I just repeated myself. So that's what I have here. I have a stack of studies for us to look at. Many are just observational in nature, both prospective and retrospective. There are some randomized controlled trials in here as well. There's some expert editorials, some meta-analyses, some literature reviews. I tried to stick with journals who are kind of more well-known and trusted, like JCEM, Journal of Endocrinology and Metabolism, which is kind of like the Bible for the Endocrine Society. JAMA, Journal of the American Medical Association, the European Heart Journal, the American Diabetes Association, the American Heart Association, European Journal of Endocrinology, etc. Clearly, if I did a deep dive into all of these, which I would love to do, but that would take all day. So I think the most practical thing to do here for the sake of time is just read from the abstracts or the conclusions, which I don't like to do because the data within the study is the most important part. But the goal here really is kind of just to give you an idea of how much data there is out there to suggest that having low testosterone levels is a predictor of poor health and poor health outcomes, and also how restoring levels of testosterone improves health outcomes. And many of these studies actually go on to explain why that is and the physiology behind it. But also, these are not my opinions, okay? I'm just simply quoting the literature here. So let's take a dive into this stack and get through it as fast as possible. All right, so this first study, it's a prospective study, observational study from the European Heart Journal. They were looking at about 2,000 men over a period of 7 years, comparing low testosterone to normal testosterone. their results, men with low serum testosterone levels had a significantly higher mortality from all causes than men with higher serum testosterone levels, and that risk was more than double actually in the group who had low testosterone. This is from data out of the Epic Norfolk study, where they looked at about 11,000 men over a period of 10 years, looking at the relationship between testosterone, testosterone levels, I should say, and death due to cardiovascular disease, cancer, all-cause mortality. And their conclusion: higher endogenous testosterone is associated with lower subsequent mortality from all causes, cardiovascular causes, and cancer. Men in the top quartile for endogenous testosterone concentrations had a 40% lower risk of death due to any cause than men who were in the bottom quartile. And this was independent of age, BMI, smoking, other lifestyle factors, cardiovascular risk factors, etc. This was an editorial by Basaria out of the Division of Endocrinology at Boston University School of Medicine. Low serum testosterone levels are a risk factor for diabetes, metabolic syndrome, inflammation, and dyslipidemia. A few things interesting in this study that I wanted to go over. Concentrations of free testosterone, even in the low normal range, are associated with diabetes after adjusting for adiposity. Interventional trials have shown that testosterone administration results in increased glucose uptake by the muscles, thereby improving insulin sensitivity. Another study showed testosterone replacement inhibits incorporation of triglycerides into visceral fat, which is what contributes to insulin resistance. Thus, even low normal levels of testosterone appear to be a risk factor for metabolic dysregulation. In contrast to the belief of many physicians that testosterone replacement leads to adverse lipid profiles, research shows that testosterone replacement is at least neutral, if not beneficial, to lipids. Trials of testosterone replacement have shown an improvement in lipid profiles. In the Rotterdam study, they found that men in the highest tertile of testosterone had a risk reduction of 60 to 80% of severe aortic atherosclerosis after controlling for age and cardiovascular risk factors. Population studies have shown that systolic and diastolic blood pressures are inversely correlated with testosterone. So the lower your levels of testosterone, the higher your blood pressure is more likely to be. They were looking at a study, it looks like about maybe 1,500 men. Baseline testosterone levels were inversely related to deaths. This protective effect of testosterone increased with increasing quartiles, such that men in the highest quartile had a 30% lower risk of death compared with those in the lowest quartile. This was out of a hemodialysis journal, interestingly. Low serum testosterone, arterial stiffness in male hemodialysis patients. Conclusion, we have shown that testosterone deficiency in male hemodialysis patients is associated with increased cardiovascular disease and all-cause mortality, and that increased arterial stiffness may be a possible explanation of this association. This was another editorial. This one's by Basaria again and Dobbs out of Johns Hopkins University School of Medicine, published in the American Heart Association. Recently, a prospective study of about 800 men looked at the relationship of testosterone with all-cause death over the subsequent 2 decades. The authors found that men whose total testosterone levels were in the lowest quartile were 40% more likely to die than men with higher testosterone levels, independent of age, adiposity, lipids, lifestyle, etc. Testosterone levels are inversely related to fat mass. The lower your levels, the more fat mass you're likely to have. Testosterone administration decreases adiposity in men. The vascular system seems to be an important target of androgen action, and current evidence suggests that androgens are beneficial to the vascular system. Testosterone levels are also inversely related with arterial calcification. Arterial stiffening and increased atherosclerosis are 2 mechanisms by which male hypogonadism may contribute to the high risk of death. Epidemiological studies show that low testosterone levels are independently associated with type 2 diabetes. In fact, lower concentrations of free testosterone, even in the normal range, are associated with diabetes. Low testosterone levels independently predict development of the metabolic syndrome in middle-aged men. And then up here, and I'll have to paraphrase this one because it sounds confusing how it's worded here. For every increase of 173 in the testosterone level, the death rate decreased by 14%, and that was independent of the patient's age. This one's out of the Journal of Clinical Endocrinology and Metabolism, the effect of testosterone replacement on inflammatory cytokines and lipid profiles. Testosterone replacement shifts the cytokine balance to a state of reduced inflammation and lowers cholesterol. This is actually a randomized controlled trial. There are several case reports in smaller clinical trials of testosterone therapy in humans with rheumatoid arthritis and systemic lupus erythematosus, in which major improvements of clinical status and inflammatory markers have been recorded. We have shown that testosterone replacement induces an anti-inflammatory shift in cytokine balance. Testosterone replacement in men with symptomatic androgen deficiency is indicated to improve quality of life, maintain lean body mass, and preserve bone density. That's an interesting thing to say there. Symptomatic androgen deficiency. Notice they didn't say hypogonadism. What's the difference? Well, hypogonadism has been defined inappropriately by the FDA as two testosterone levels less than 300 that were tested first thing in the morning on 2 separate occasions. That's what they've approved its use for. Symptomatic androgen deficiency, on the other hand, would simply be a man's own individual threshold, the level where signs and symptoms start to manifest. It's not defined by an arbitrary number. And yes, that level of 300 assigned by the FDA, it was completely arbitrary. I'm not kidding. There was no literature or science to support the number that they picked. But these authors say that symptoms of androgen deficiency is an indication to use testosterone replacement for improvements in quality of life, to maintain the lean body mass, to preserve bone density. The next one is another one out of the Journal of Endocrinology and Metabolism, looking at testosterone treatment and mortality in men with low testosterone levels. They were looking at about 1,000 hypogonadal men with low testosterone. Some went on to get treated with testosterone replacement therapy, and the other group did not. What they found here, the mortality in testosterone-treated men was 10.3%, compared with 20% in the untreated men. So which group would you like to be in there? All right, testosterone supplementation in heart failure. This is out of the American Heart Association's Heart Failure Journal. Low testosterone is an independent predictor of poor clinical outcomes in patients with heart failure. Testosterone therapy was associated with a significant increase in exercise capacity. No significant adverse cardiovascular events were noted. Testosterone therapy appears to be a promising therapy to improve functional capacity in patients with heart failure. Low free testosterone is associated with heart failure mortality. Let me go into this study here just a little bit. Testosterone has been shown to be associated with HDL cholesterol, the good one, blood pressure, and waist circumference in a favorable manner. Caminiti et al., a randomized controlled trial, male patients with stable congestive heart failure, testosterone therapy improves exercise capacity, muscle strength, glucose metabolism, and baroreflex sensitivity. In men with low testosterone and coronary heart disease, testosterone supplementation resulted in increased perfusion of the myocardium and increased left ventricular ejection fraction. This was a randomized double-blind placebo-controlled trial looking at the beneficial effects of testosterone therapy on functional capacity, cardiovascular parameters, and quality of life in patients with congestive heart failure. Just real quick, to summarize, significant increase in functional capacity and quality of life without negatively affecting blood pressure, heart rate, or weight change from fluid retention. And this is testosterone in congestive heart failure. Another one, how to JCEM. This looks like about a 20-year study. Men whose total testosterone levels were in the lowest quartile were 40% more likely to die than those with higher levels, independent of age, adiposity, lifestyle, and a whole bunch of other risk factors here. European Journal of Endocrinology. This was a meta-analysis. Hypogonadism as a risk factor for cardiovascular mortality in men. Lower testosterone levels correlate with increased risk of cardiovascular disease and cardiovascular mortality. Testosterone replacement therapy in hypogonadism moderates metabolic components associated with cardiovascular risk. Endogenous testosterone and mortality in men, another meta-analysis out of JCEM. Low endogenous testosterone levels are associated with increased risk of all-cause and cardiovascular death in community-based studies of men. Another one out of JCEM. Low levels of endogenous androgens increase the risk of atherosclerosis. In conclusion, we found an independent inverse association between levels of testosterone and aortic atherosclerosis. So the lower your testosterone levels, the higher the association was with atherosclerosis. This was a review out of basically Great Britain's Endocrine Society, their version of it. Testosterone is a hormone that plays a key role in carbohydrate, fat, and protein metabolism. It has been known for some time that testosterone has a major influence on body fat composition and muscle mass in the male. Clinical trials demonstrate that testosterone replacement therapy improves insulin resistance as well as glycemic control and also reduces body fat mass, in particular truncal adiposity, cholesterol, and triglycerides. Real quick, I thought this was interesting. Up to 70% of the body's insulin sensitivity is accounted for by muscle. Insulin-stimulated glucose uptake, insulin sensitivity, uptake into the muscle is in adipose tissue, really, is largely mediated by the GLUT4, basically GLUT4, it's a protein. Testosterone actually increases that GLUT4 protein expression, which is why we see improved insulin sensitivity in male patients taking testosterone replacement therapy. This one's out of endocrine disorders. Low serum testosterone predicts acute myocardial infarction in men with type 2 diabetes. Low concentrations of testosterone predicted acute heart attack in men with type 2 diabetes independent of other risk factors. European Journal of Endocrinology. This is a clinical study called Testosterone Deficiency is Associated with Increased Risk of Mortality, and Testosterone Replacement Improves Survival in Men with Type 2 Diabetes. So basically what they did here, the mortality, let me put it like this. The mortality in the low testosterone group was 17%. The mortality in the normal testosterone group was 9%, almost half. So they took all these men who had low testosterone and type 2 diabetes, and they gave one group of men testosterone replacement, the other group did not get testosterone replacement. The men who had low testosterone and diabetes, type 2 diabetes, and were given testosterone, their mortality rate was 8%. Whereas the men who had type 2 diabetes, low testosterone, and did not go on testosterone replacement therapy, their mortality rate was 19%. That's more than twice there. Which group do you want to be in here? Androgens and diabetes in men from the American Diabetes Association. Men in the lowest tertile of free testosterone levels were 4 times more likely to have prevalent diabetes compared with men in the highest tertile. Low free testosterone concentrations in the normal range were associated with diabetes independent of adiposity. In the normal range, even. This is a randomized, double-blind, placebo-controlled trial called Testosterone Replacement in Hypogonadal Men with Type 2 Diabetes and/or Metabolic Syndrome. In type 2 diabetic patients, glycemic control was significantly better in the testosterone replacement group than the placebo group. Improvements in total and LDL cholesterol, lipoprotein A, body composition, libido, and sexual function occurred in selected patient groups. When you look at the study, that selected patient group was those with metabolic syndrome. There were no significant differences between groups in the frequencies of adverse events. This is an interesting study here. It's an 11-year study looking at men with both low testosterone and type 2 diabetes. All of them were already on standard diabetes treatment. Half of them went on to receive testosterone replacement therapy. The other half did not. So what happened? Well, the men who, let me just read this to you. Among the patients treated with testosterone, 34% of them achieved complete remission of their diabetes, and 46% achieved normal glucose regulation. Of the testosterone-treated group, 83% reached the A1C target of 6.5. 90% achieved a A1C target of 7. In contrast, well, let me just read this. What about the men not getting testosterone? Not a single one. saw a reduction in their hemoglobin A1C, even though they were getting standard diabetes treatment. In fact, every single one of them saw their diabetes progress and worsen. For the entire 11 years, for the men getting testosterone, the hemoglobin A1C trended down, the fasting insulin trended down, as did the fasting blood glucose, triglycerides, LDL cholesterol, and weight. Men on the testosterone treatment group lost a significant amount of their body weight, while the standard diabetes treatment group gained weight. The standard diabetes group not getting testosterone saw increases in their hemoglobin A1C, their fasting blood sugar, their fasting insulin, their triglycerides, and their LDL as well. So how's that standard diabetes treatment working out for you? Well, what about side effects? The men receiving testosterone had no heart attacks, they had no strokes, they had no blood clots, and they had no new cases of prostate cancer. I thought testosterone caused all those things. Well, okay. Whereas in the group not receiving testosterone, there were literally dozens of new heart attacks, strokes, new prostate cancer cases. No new blood clots though, so that's good. Which group do you want to be in here, right? Again, it's a prospective observational trial, so a study. So it's not as good as a randomized controlled trial, but still these groups were matched for age, for their weight, duration of diabetes, cholesterol, statin use, renal function, baseline testosterone levels, prior cardiovascular disease, and it was an 11-year study, so that's not bad for a prospective observational study. This next one, though, is a randomized, double-blind, placebo-controlled trial, phase 3B trial, published in the Lancet last year, actually. Results: testosterone treatment for 2 years reduced the proportion of participants with type 2 diabetes beyond just the effects of the lifestyle program. Moving along, Journal of Clinical Endocrinology and Metabolism, randomized, double-blind, placebo-controlled trial. They were looking at men older than 65. The men who received testosterone, fat mass decreased. The men who received testosterone, the lean mass increased. The lean muscle mass increased. That's to be expected. This one is out of endocrinology, diabetes, and metabolism. This one is a 14-year study looking at men with type 2 diabetes and hypogonadism, and observed over time just what happened. So here's what happened. With men with low testosterone, 56% of them died. Men with normal testosterone, 36% died. So those, reduced risk of death by 20%. This is out of the International Journal of Obesity. Long-term testosterone therapy in hypogonadal men, irrespective of weight at baseline, produced improvements in body weight, waist circumference, and body mass index. Furthermore, testosterone therapy decreased fasting blood glucose and hemoglobin A1C and improved lipid profiles. Gradual decreases in blood pressure, both systolic and diastolic, occurred in men treated with testosterone in each group. Marked reductions in mortality and major cardiovascular events were recorded in men receiving testosterone therapy. Getting through most of it here. American Journal of Cardiology, we've just got a few left. The objective of this study was to determine the incidence of recurrent myocardial infarction. Recurrent, that means they've already had the heart attack, they already have cardiovascular or coronary disease. And in conclusion, and they were giving these men testosterone versus a group with no testosterone. In conclusion, normalization of testosterone levels with testosterone replacement therapy was associated with a decreased all-cause mortality compared to those with non-normalized testosterone in the untreated group. Furthermore, in this high-risk population, remember, they've already had their heart attack, they already had their heart disease, testosterone replacement therapy was not associated with an increased risk of recurrent heart attack. This one's out of JAMA, Journal of the American Medical Association, Internal Medicine. Among men with androgen deficiency, testosterone prescriptions were associated with lower risk of cardiovascular outcomes over a median follow-up of 3.4 years. What were those risk reductions? Reduced risk of cardiac events by 33%, reduced risk for stroke by 28%. Both of those were statistically significant. This was a retrospective observational study. I wouldn't put a whole lot of, I wouldn't give that much credibility. Low serum testosterone and estradiol predict mortality in elderly men. Elderly men with low serum testosterone and estradiol have increased risk of mortality. Subjects with low values of both testosterone and estradiol have the highest risk of mortality. That one's out of JCEM, Journal of Clinical Endocrinology and Metabolism. This is another retrospective observational study. Testosterone therapy was associated with a reduced risk of heart attack by 31%. It was statistically significant. It says here it was modestly protective against heart attacks. This one is testosterone therapy results in more fat loss and preservation of fat-free mass, which is lean muscle mass, compared with diet and exercise interventions alone. In contrast to weight loss achieved by diet and exercise and bariatric surgery, testosterone therapy significantly preserves both muscle and bone mass. Further, testosterone therapy has psychological effects that may increase the motivation and ability of men to adhere to a diet and exercise program, which is sometimes half the battle. Real quick, these last couple. This one's out of the Journal of Neurology, looking at free testosterone and Alzheimer's. The last page, results of the current study suggest that in aging men, maintenance of free testosterone concentrations in the higher part of the normal range may decrease the risk of Alzheimer's disease. There's a lot more studies out there on testosterone and Alzheimer's. This one's out of MD Anderson Cancer Center. Low serum testosterone is associated with tumor aggressiveness and poor prognosis in prostate cancer. Low levels of testosterone were significantly associated with a 10-fold increased risk of prostate cancer-specific mortality. The results of the present study indicate that low levels of serum testosterone at diagnosis of prostate cancer are associated with aggressive prostate cancer and predict poor prostate cancer-specific survival. This one's out of OncoTarget. This is from 12 different urology departments in Europe. Low serum testosterone levels were significantly associated with upgrading, upstaging, and unfavorable disease and positive surgical margins with prostate cancer. For those diagnosed with prostate cancer, of course, with low serum testosterone levels are more likely to have aggressive prostate cancer. All right, that's it. I hope you made it through all of that. This was just a small sampling, though, of the available literature on this topic, and I actually removed several studies, several other studies that I printed out just for the sake of time. So can we call all of this indisputable, unquestionable evidence? From a truly scientific standpoint, I don't know that we can say it is yet. There's a lot of association studies, and there's also a lot of randomized controlled trials, too. But it certainly makes sense from a physiological standpoint, and we're seeing more and more data accumulating to support this concept rather than the other way around, which is how it's been for a long time. And when you think about it from a purely physiological standpoint, forget all that feel-good stuff. I'm talking about what that testosterone molecule is actually doing when it binds to those receptors in the cells, and all of that post-receptor physiology that's occurring, and the importance of that entire signaling cascade within tissues all over the body. Some might argue that, losing testosterone is just a natural part of growing old. Well, that's kind of a loaded statement and not really true to the degree that many think it is. And second of all, losing our hearing, losing our vision, losing, or macular degeneration. That's another one. Arterial wall stiffening, hypertension. All of that's a natural part of growing old too. But are we just ignoring those things and telling patients they're not 30 anymore? No, doctors intervene and treat. We treat hearing loss and vision loss and hypertension to improve quality of life and to hopefully prolong life. We treat to prevent long-term secondary complications. I do the same thing with hormones, and in this case, testosterone. If you have concerns about risks and side effects, watch my previous video where I discuss all of those things in depth, and shoot me an email if you have any questions about that. Now, to wrap this up, I'm not saying run out to your PCP's office and ask for testosterone. That's not really what this video is about. This video is to just bring some awareness and bring your attention to a potential issue it's rarely talked about, an issue that we in the medical community, we need to be aware of it and not be so quick to just brush it off because it might seem like a foreign idea to us and not something we're used to hearing about. So, okay, that's it. Everybody stay safe, be healthy, be active, make good food choices, and I'll see you on the next video.